Hi everyone, today we are going to talk about essentials of a good latch. Positioning. Tuck baby close to mom with back straight. Use pillow to support baby's bottom. Hold head behind ears. Baby's head slightly extended. Line up baby's loose with nipple. Offer the breast. Line your fingers up with baby's lips behind the areola. Use sandwich hold. Squeeze areola gently. Aim your nipple between baby's nose and top lip. Place baby's lower lip on lower edge of the areola. Bring baby to breast, not breast to baby. Quickly, chin first. Check on the latch on. Look for flanged lips, open mouth to 140 degrees. Place most of areola in baby's mouth. Ensure no pain, no wedged or creased nipple. Check that chin is touching breast. Asymmetrical latch on. Assess the milk transfer. Watch for a wide jaw movement. Look for consistent suckling. Listen for swallowing after milk comes in. I hope we have helped you learn how to identify a good latch. Thank you for watching.